Hello friends, welcome to my channel. Here we are today to discuss about growth and development and also factors affecting growth and development and principles of growth and development. So before going into the topic, we should first learn about what is growth and development. Okay, so there is a lot of difference between growth and development. Growth means it is a physical maturation. Here, that means the body grows in the size and also the various organs grows and develops. Okay. Now, what is development? Development is a maturation, means whereby the child learns the skills, and not only that, here the maturation of the nervous system takes place. So because of which the baby's psychological, emotional and social changes occurs. So it is one of the qualitative aspect, whereas a growth is a quantitative changes that takes place in the body, means the size, the shape of the body and also the growth of the various organs, whereas the development is nothing but a maturation. Okay, so it is qualitative aspect. So next we'll see about the principles of growth and development. So in the principles of growth and development, we are going to see three important principles of growth and development here. That is, the growth takes place in a cephalocaudal direction. So what is a cephalocaudal direction? Cephalo here, it refers to the head and caudal refers to the tail. Okay, so that means the growth and development always proceeds from the head to the region of the trunk, means the legs. Okay, so what is cephalocaudal direction? The cephalocaudal direction is the growth that takes place from the head down to the tail. We call it as cephalocaudal. Okay, next is proximal distal. Proximal distal direction is the growth and development takes place from the midline to the periphery. For example, when the baby is developing, always the baby holds the things from the palm of the hand and not from the fingers. But when later on the baby develops, the growth and development takes place in the baby, they start holding with the fingers. So you might remember how you were holding the pencils during your childhood. Okay, beginning you used to hold the entire hand and later on only you're used to write with your fingers, right? So previously you might have written with the pencil holding with the entire palm. So this is an example for this proximal distal direction. That is, the growth and development always proceeds from the center to the periphery. Okay, and next important principles of growth and development is general to specific. General to specific, we'll take the same example here. The baby will use the entire palm for holding some objects or with both the hands before trying to learn to use the fingers. So that means the baby is trying to use the general means the large muscles first, and then only the fine muscles starts to develop. Okay, so this is an example of general to specific. So hope you understood the principles of growth and development. I will repeat it once again for a review. So there are three important principles of growth and development. That is, one is the growth takes place in a cephalocaudal direction, growth takes place in a proximal distal direction, and from general to specific. So these are the three important points that you should remember, the principles of growth and development. Next, we move on to factors influencing growth and development. So growth and development is influenced by many factors. Okay, so it can be divided into internal factors or external factors. Okay, internal factors and external factors. So internal factors means the postnatal period and the prenatal period, how does it affect the growth and development. And not only that, even the external factors like environment can also influence the growth and development. So we'll be discussing one by one what are the important factors that is affecting the growth and development. Okay, first of all, as I told you, genetic factors, sometimes certain congenital diseases or disorders can affect the growth and development of a children, which is passed down from one generation to another one, okay, because of the chromosomal factors. Next one is the prenatal factors. The prenatal factors, you're going to see both the intrauterine environment, okay, in and the postnatal factors. Okay, in intrauterine environment, it is an important factors that is affecting the growth and development. Means it mainly depends upon the maternal nutrition, means how the mother takes the nutritious food during her pregnancy, whether she is having any malnourishment during the time of pregnancy can also affect the developing fetus. Not only that, if the mother is affected with a certain infectious diseases during our pregnancy, it can also result in the factors can also result in the it can also affect the growth and development. And next, if the mother is taking any unwanted substances or substance abuse, or if she had any hormonal problems, or if she had exposed to any harmful radiations, can also affect the growth and development of the fetus. Okay, so that is why it all comes under the prenatal factors. It mainly depends upon the health and well-being of the mother. Okay, next is the postnatal factors, means once the baby is born, what are the factors that is going to affect the growth and development of the baby. Okay, so it mainly depends upon the growth potential. Means growth potential always it comes from the parents. Okay, it is passed down from the parents. How the parents had the growth and development, same in that way the growth and development of a child proceeds. Next is nutrition. How well the child is given the nutritious food. Okay, the baby has to be taken care, providing all the nutritious foods for the children in a proper way can result in a good growth and development. And the next thing that comes under the postnatal factors is childhood illness. If at all, if the baby was affected with some of the illnesses during the developmental stages, it may affect the stage, or sometimes the growth and development may be delayed, or it may be completely lacking there. Next one is socioeconomic status. It all depends. So if at all, if the baby, if especially when the baby is coming from a poor socioeconomic status, that means the baby won't be getting enough nutritious food. Lack of hygiene can also be an contributing factors here. Next one is climate and season. So how does the climate and season is going to affect the growth and development? It is mainly because, see, in certain climates the infectious diseases are more common. So when the baby is affected with the infectious diseases, the baby is going to have a delayed growth and development, or sometimes the growth and development the next factor is play and exercise. Play is a very important thing that the baby should get. If we are giving a proper play for the allowing the baby to play properly, that itself can give a proper immune development for them. Their immunity starts the building, and they'll have this cognitive development also with the help of play. And the hormonal, next one is the hormonal influence. Certain times what will happen, if the hormonal imbalances occur, For example, growth hormones. Growth hormones reduction, or sometimes when the growth hormone production is more, it can result in a certain types of disorders, that is gigantism and dwarfism, that is what we call it. So these are the examples how the hormones can influence the growth and development. Okay, so these are the factors that comes under the postnatal factors. So next, under the growth and development, we are going to discuss about the each stages of growth and development. So growth and development proceeds in stages. I already told you growth and development proceeds in stages. So we'll see the different stages of growth and development. First one is infancy stage, that is in infancy it is again divided into the early infancy and the late infancy. The early infancy is the period of neonatal period, that is from birth to 1 month, and the late infancy is from 1 month to 1 year. Next is early childhood. In early childhood, it is divided into the toddler period. Toddler period is from 1 to 3 years, and the preschool is from 3 to 6 years. The middle childhood periods is classified again into school age period. The school age period is begins when the child is from 6 years to 12 years, and the late childhood period is the adolescent period. It begins from 13 years to 18 years. So these are the different stages of growth and development. Okay friends, thank you for your patience listening. So this is a small topic about growth and development.